Dr. Sue Decotiis of New York City. I am a regenerative medicine physician and a functional medicine physician. I'd like to talk to you today about something called exosomes. That's beginning to become a buzz term. So what are exosomes? Well, these are very potent products that actually come from mesenchymal cells of the placenta. And they're not actually cells, though. In the process of making exosomes, an FDA-approved laboratory basically just gets the most important component of these cells out of those cells, and those components have intracellular ingredients, very important things such as microRNA and things that are genetic materials. So when a patient gets exosomes, and we usually infuse them with an IV, these exosomes can regenerate the body. They have a great ability to pass the blood-brain barrier, which means it gets into the central nervous system and throughout the body. And in my practice, we've seen incredibly effective neuroregenerative results from using exosomes. Right now, we use them for anti-aging and to keep people at the top of their game mentally and physically. So what exosomes do is they actually help the connections between the cells. And as you know, each brain cell or neuron has something called a synapse. And that really basically is sort of a connecting spot between cells. So when those connecting spots between cells aren't working as well, people can have symptoms. And that's where you have all the issues with Parkinson's disease and Alzheimer's. It's all at the basis of the synapse. So when we can help regenerate the synapse through exosomes, we can have an incredible effect. So I recommend that for anti-aging, people do 1 vial of exosomes in an IV per month, or they can get 3 and do them quarterly. And so many patients feel that their memory is better, they're faster, they're more focused. For example, people that have always had to rely on ADD medication for attention deficit disorder find they don't need to take it as much. People that had a lot of anxiety and perhaps were using a lot of controlled substances like Valium and Xanax find they don't need it as much. People feel that they're able to accomplish their tasks a lot faster. And they also feel better. They feel that they have more energy. They feel that they're sleeping better. And in studies, they've shown that exosomes can really help people with Alzheimer's disease, with Parkinson's disease, and orthopedic surgeons can use exosomes, and they can actually inject them directly into the joint. Exosomes also has a potential for cosmetic rejuvenation. They can be injected into the scalp to really enhance hair regrowth. And they can be injected into the facial skin for skin regeneration. So these products are really pretty amazing. And the fact that they cause so much regeneration, they actually get your body to produce newer, healthier cells. It's really a very strong part of my anti-aging program. And I think that everybody could benefit from them over the age of 40. I think that they are an amazing asset, and I'll be telling you more about them in the future. Thank you.